There. My name is Dr. Deb Davies, and I'm a licensed acupuncturist, birth doula, and childbirth educator. And I want to give you a little knowledge bite about postpartum, and especially around C-sections, recovering from a C-section postpartum. So, giving birth and being postpartum can be a very challenging time for so many women, and especially if they underwent major abdominal surgery. And whether it's planned or unplanned, oftentimes it leads to birth trauma and other frustrating issues. So in the United States, currently, our C-section rate is 32%, which means 1 in every 3 women giving birth are having this major abdominal surgery. Now, the World Health Organization says that a normal healthy C-section rate per country should be 10 to 15%. Now, when I was born in the 1970s, the US had a C-section rate of 7 to 12%. But currently, we are 2 to 3 times over what the World Health Organization considers healthy. Now, C-section rates can vary city to city, state to state, hospital to hospital, and even where I live in LA, there's one hospital that has a 70% C-section rate. And you can look this stuff up on cesareanrates.org. So in the US, the maternal mortality rate is very high. It's 24 out of every 100,000 women dying in and around giving birth, or their babies too. And that number has gone up from 2018, where it was 17 out of 100,000. So it's so upsetting to see a country with so much money and resources and technology and having so many deaths. And if you're a woman of color, you're 3 or 4 times more likely to die, and or your baby to die in and around giving birth. So recently I did a talk with a group of Israeli acupuncturists. And so I did a little research because I was doing a class on birth. And what I found in Israel is they have 3 out of every 100,000 women with maternal mortality. So they're very low. The US has the highest maternal mortality rate of all developed countries in the world. Number one, we are the worst. So there's so much that we can do as Chinese medicine practitioners to support this. So much, from scar treatments, helping with their anxiety, depression, breast-related issues, all sorts of things. And so really sharing this information, because learning about it, and so many people treat fertility, but then getting comfortable to treat pregnancy and postpartum women by sharing with them things that you can help them with during their fertility or during their pregnancy, and really encouraging those women to put as much time into their postpartum healing as they did when they were going through fertility and pregnancy. So that is my little knowledge tip. Thank you.